Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 15 of my multi-part video series of doing so. Today, we will be taking a look at an overview of lymphomas. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at an overview of lymphomas. Lymphoma is a cancer of the lymphatic system. It usually starts in lymph nodes, but can also affect the spleen and bone marrow. Typically, lymphomas are of B-cell origin. Lymphomas are classified into Hodgkin and Non-Hodgkin (NHL) types. Risk factors include Epstein-Barr virus, HIV, immunosuppression, chronic corticosteroids or immunosuppressant drugs, and autoimmune diseases, for example, SLE, Hashimoto's thyroiditis. Let's next take a look at Hodgkin lymphoma. Hodgkin lymphoma is characterized by Reed-Sternberg cells, which are CD15 or CD30 positive B cells with an owl eye appearance. Vignettes often describe a painless lateral neck mass or facial swelling, lymphadenopathy. Additional findings may include hepatomegaly, mediastinal mass, or Virchow node, palpable left supraclavicular lymph node. B symptoms, fever, night sweats, weight loss, are common, but not required. Normal leukocyte count and differential may be seen. For example, white blood cells of 10,000 per microliter with lymphocytes at 33%. Prognosis varies with the type. Leukocyte-rich Hodgkin has a better prognosis compared to leukocyte-deplete Hodgkin. Let's next take a look at non-Hodgkin lymphomas. Burkitt lymphoma T814, translocation of the CMIC gene, presents as jaw lesion in African boys or abdominal lesion. Starry sky histology with tingible body macrophages. Follicular lymphoma T1418, translocation of BCL2 gene, presents as a painless, waxing, waning neck mass over 1-2 years, most common indolent NHL. Diffuse large B-cell lymphoma DLBCL, most common aggressive NHL mantle cell lymphoma T1114, translocation involving overexpression of cyclin D, preventing cell cycle arrest. Mycosis, fungoids, cutaneous T-cell lymphoma with cerebriform-shaped cells, less aggressive than Sézary syndrome, and does not extend to the blood. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 35-year-old man presents with a painless mass on the left side of his neck that he first noticed 3 months ago. He also reports intermittent fevers, night sweats, and unintentional weight loss of 10 pounds over the past 2 months. Physical examination reveals a 2 centimeters firm, non-tender lymph node in the left cervical region. There is no hepatosplenomegaly. His medical history is significant for HIV infection, diagnosed 5 years ago, for which he is on antiretroviral therapy. His family history is unremarkable. Laboratory studies show white blood cell count of 9,000 per microliter, normal range 4,000 to 11,000 per microliter, with a differential of 30% lymphocytes, normal range 20 to 40%. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is A, Hodgkin lymphoma. The patient's presentation of a painless lymph node, systemic symptoms, fevers, night sweats, weight loss, and a history of HIV infection is highly suggestive of Hodgkin lymphoma. Hodgkin lymphoma is characterized by Reed-Sternberg cells and commonly presents with these B symptoms and lymphadenopathy. The normal WBC count and differential support this diagnosis, as Hodgkin lymphoma is a cancer of the lymphatic tissue rather than circulating white blood cells. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, follicular lymphoma, typically presents as a waxing and waning painless lymphadenopathy over years, without the pronounced systemic symptoms described here. C. Burkitt lymphoma often presents with a rapidly growing mass, frequently in the jaw or abdomen, and is associated with the CMIC translocation. It is more common in children and has a starry sky appearance on histology. D. Diffuse large B-cell lymphoma, DLBCL. While it is an aggressive NHL and could present similarly, the classic presentation and patient's history are more indicative of Hodgkin lymphoma. E. Mantle cell lymphoma, characterized by a T1114 translocation and overexpression of cyclin D1. It often presents in older adults and is less likely to present with systemic B symptoms compared to Hodgkin lymphoma. All right, now that we have covered this question, let's move on to look at the next question. A 28-year-old woman presents with a 3-month history of a painless swelling on the right side of her neck. She also reports experiencing occasional night sweats and a 5-pound weight loss over the past 2 months. On physical examination, a 3 centimeters firm, non-tender lymph node is palpable in the right cervical region. There is no hepatosplenomegaly. Her laboratory results show a white blood cell count of 11,000 per microliter. Normal range, 4,000 to 11,000 per microliter, with 30% lymphocytes. Normal range, 20 to 40%. A biopsy of the lymph node reveals large cells with bilobed nuclei and prominent nucleoli. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C. Hodgkin lymphoma. Hodgkin lymphoma is indicated by the presence of Reed-Sternberg cells, large cells with bilobed nuclei and prominent nucleoli. The typical presentation of a painless lymph node and B symptoms, night sweats and weight loss. The normal leukocyte count and lymphocyte percentage further support this diagnosis, as Hodgkin lymphoma involves lymphatic tissue rather than circulating white blood cells. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Burkitt lymphoma often presents with a rapidly growing mass, typically in the jaw or abdomen, and involves a starry sky pattern on histology, which is not described here. B. Follicular lymphoma usually presents with painless, waxing, and waning lymphadenopathy over years, without the acute B symptoms described in this case. D. Mantle cell lymphoma, characterized by the T1114 translocation and overexpression of cyclin D1. It typically presents in older adults and does not usually present with Reed-Sternberg cells. E. Diffuse large B-cell lymphoma, DLBCL. While it can present with similar symptoms, the presence of Reed-Sternberg cells is specific for Hodgkin lymphoma. DLBCL lacks these characteristic cells. All right, now that we have covered this question, let's move on to look at the next question. A 65-year-old man presents with a 2-year history of a painless, waxing, and waning mass on the side of his neck. Recently, he has noticed an increase in the size of the mass, which has become more consistent. He denies any weight loss, fever, or night sweats. Physical examination reveals a firm, non-tender lymph node in the left cervical region. A biopsy of the lymph node shows a T1418 translocation and an overexpression of BCL2. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C. Follicular lymphoma. Follicular lymphoma is characterized by the 11-14-18 translocation and overexpression of the BCL2 gene, which is consistent with the patient's presentation of a painless, waxing, and waning neck mass over a prolonged period. This type of lymphoma is the most common indolent non-Hodgkin lymphoma. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Burkitt. Lymphoma. Typically presents with a rapidly growing jaw lesion in African boys or an abdominal lesion, along with a starry sky histology, which is not described in this case. B. Diffuse large B-cell lymphoma, DLBCL. This is the most common aggressive NHL and would more likely present with rapid enlargement of lymph nodes and systemic symptoms, not a waxing and waning mass over years. D. Mantle cell. Lymphoma. Characterized by the T11-14 translocation and overexpression of cyclin D1, it usually presents with more aggressive features and does not have the waxing and waning nature described here. E. Mycosis fungoides, a cutaneous T-cell lymphoma that presents with skin lesions and cerebriform-shaped cells, not typically with lymphadenopathy as described in this patient. All right, guys, that is all I have for today. Be sure to leave a like if you found this video useful, a dislike if you did not find this video useful, and consider subscribing for more content like this in the future. If you would like to check out more review material, be sure to check out my other USMLE/NBME playlists on the channel. If you have any questions, comments, concerns, or suggestions you would like to make, please be sure to write them up and submit them in the comment section below. This is FixerMed signing off. Be sure to have a great day or great night, and as always, good luck studying.